out of everything you do, this is the most dangerous thing. So as you're preparing to give an injection, or after you've given an injection or started an IV, you should be on alert until you safely dispose of that hazardous substance. And I think one of the problems is because you're dealing with it all the time, you become nonchalant about it. You become, you know, this is something I do all the time. Or you go through so many days without having a needle stick, you begin to think you're above it.
Very, very important to make sure that we are helping the staff, that they're not getting introduced to any pathogens from patients. So I want to take this pledge to ensure that we can have a nationwide force to make sure that we're providing the adequate tools in the clinical setting.
Unfortunately, somebody didn't empty the Needlestick boxes, and so I reached down to put a needle in the box, and the needle was sticking out, and so I stuck myself. I mean, it was scary, and I just didn't know what was going to happen. I didn't know whose needle it was, and I was terrified.
I would tell you about my most recent story, where I was in the operating room and I was closing a wound. It was a cervical fusion. And I actually stuck myself when I was closing, and I knew the patient had a past history of IVDA, and I had to go to employee health and be tested, and I actually had to go on the antiviral medication myself for a couple of days, which was completely awful until her testing came back. And I would hate for anyone to have to do that.
Mine, I worked in a prison where we had a lot of hepatitis B positive, C, HIV positive patients. I reached into to get a lancet, and somebody had replaced it. One that had already been used threw it in the wrong container, and I got stuck. So I had to go through testing for several years, and I still get tested just to make sure that there isn't a problem.
Yes, I did have a Needlestick story. When I was a nurse in the ICU long time, years ago, I did stick myself with the needle. Thank God I have to follow for an year for hepatitis and HIV. Thank God the patient did not have any of those diseases, so it scared me.
I think that the needle stick is an issue that you forget about until you pull out the needle, and then you get to talking, and it's something that is always in your mind.
Support Safe and Common. We need to protect ourselves and our patients.
Take the pledge and support Safe and Common.
So everyone, you should support Safe and Common, sign the pledge. It's an important thing to do for yourself and your colleagues, and get safety into healthcare is really important.
Take the pledge and support Safe and Common.
Take the pledge and support Safe in Common.